Syphilis is a serious health problem. It's a sexually transmitted infection. Syphilis can have serious consequences if left untreated, but it is curable with the right medicine. We're going to break down everything you need to know about syphilis. Syphilis is sneaky. It often doesn't show symptoms right away. This makes it easy to spread without knowing it. That's why it's important to learn about syphilis and practice safe sex. Knowing the facts can protect you and your partners. Let's dive in. Syphilis is caused by a bacterium. This tiny organism is called Treponema pallidum. It's a spirochete, a spiral-shaped bacterium. This unique shape helps it move easily through your body. Treponema pallidum can't survive long outside the body. It needs warmth and moisture. This is why it's mainly spread through direct contact. This usually happens during sexual activity. Understanding how syphilis spreads helps us prevent infection. Syphilis progresses in stages, much like a story unfolding over time. Each stage has its own set of symptoms and characteristics, making it crucial to understand the progression of this disease. Think of it like a play in 4 acts, each act revealing a new layer of the story. The first act sets the stage, the second act builds tension, the third act hides secrets, and the fourth act brings the climax. Each act has unique characteristics and symptoms. Act 1, Primary Syphilis. This is the beginning of the story where the first signs of infection appear. This starts with a sore called a chancre, which is usually painless but highly infectious. It often appears at the site where the bacteria entered the body, such as the genitals, rectum, or mouth. Act 2, Secondary Syphilis. You might experience a rash, fever, or fatigue. This stage can also include symptoms like swollen lymph nodes, sore throat, and muscle aches. The rash often appears on the palms of the hands and soles of the feet, but it can occur anywhere on the body. Act 3, Latent Syphilis. This stage is hidden with no noticeable symptoms. The bacteria remain in the body, but there are no outward signs of infection. This stage can last for years, and without treatment the disease can progress to the final stage. Act 4, Tertiary Syphilis. This is the most serious stage, potentially affecting organs such as the heart, brain, and nerves. It can lead to severe medical problems, including neurological disorders, cardiovascular issues, and even death if left untreated. It's important to remember that syphilis can be cured at any stage with the right antibiotics. Early diagnosis and treatment are crucial to prevent the disease from progressing to more severe stages. However, early treatment is always best to prevent long-term problems. Regular checkups and being aware of the symptoms can help in catching the disease early. Remember, knowledge and timely action are your best defenses against syphilis. Syphilis spreads through direct contact with a syphilis sore. This typically occurs during sexual activity. These sores are most common on the genitals, but they can also appear on the mouth, anus, or rectum. You can get syphilis from touching an infected person's sore. This includes vaginal, anal, and oral sex. Syphilis can also be passed from a pregnant woman to her unborn baby. Syphilis is not spread through casual contact. This means you can't get it from sharing utensils, toilets, or hugging. Section 5. Spotting the signs, symptoms by stage. Understanding the progression of syphilis is essential for early detection and treatment. This section will guide you through the various stages of syphilis and the symptoms associated with each stage. Knowing the symptoms of syphilis is crucial. Early detection can prevent severe health complications. Syphilis progresses through several stages, each with distinct symptoms. Primary syphilis often presents as a single painless sore, also known as a chancre. This sore typically appears at the site where the bacteria entered the body. It can be found on the genitals, anus, or mouth. Despite being painless, it is highly infectious. It can be easily missed. The chancre usually heals on its own within 3 to 6 weeks, even without treatment. However, the infection remains in the body and can progress to the next stage if not treated. Secondary syphilis may cause a rash, fever, sore throat, or swollen lymph nodes. The rash often appears as rough red or reddish-brown spots on the palms of the hands and the bottoms of the feet. It can also appear on other parts of the body. Other symptoms may include muscle aches, fatigue, and weight loss. Latent syphilis has no noticeable symptoms. This stage can last for years. During this time, the bacteria remain in the body, but there are no signs or symptoms. Without treatment, the infection can progress to the most severe stage. It can last for years. The latent stage is divided into early latent syphilis, which occurs within the first year after infection, and late latent syphilis, which occurs after the first year. Even though there are no symptoms, the infection can still be transmitted during the early latent stage. Tertiary syphilis can damage the heart, brain, nerves, and other organs. This stage can occur 10 to 30 years after the initial infection. It can lead to severe medical problems, including neurological disorders, cardiovascular damage, and even death if left untreated. If you experience any of these symptoms, seek medical attention immediately. Early diagnosis and treatment are crucial to prevent the progression of the disease and avoid long-term health issues. Early diagnosis is vital for successful treatment. Regular checkups and being aware of the symptoms can help in catching the disease in its early stages. Remember, syphilis is curable with the right medical intervention. Section 6. Genital ulcers, a telltale sign. Genital ulcers are a significant indicator of various sexually transmitted infections, with syphilis being one of the most notable. Understanding the characteristics and implications of these ulcers is crucial for early detection and treatment. Genital ulcers are a common symptom of syphilis. These ulcers or sores are often the first sign that something is amiss. They can vary in appearance, but they typically present as open sores on the genital area. Recognizing these early signs can lead to prompt medical attention and treatment, which is essential in managing the disease effectively. These sores can appear on the penis, vagina, anus, or rectum. The location of the ulcers can provide clues about the nature of the infection and its transmission. For instance, sores on the penis or vagina are often associated with sexual transmission, while those on the anus or rectum might indicate different modes of transmission or behaviors. They are often painless but highly infectious. This lack of pain can sometimes lead individuals to overlook the seriousness of the condition, delaying diagnosis and treatment. However, despite their painless nature, these ulcers are teeming with bacteria and can easily spread the infection to sexual partners. In primary syphilis, the ulcer, also known as a chancre, is usually firm, round, and painless. This chancre is a hallmark of the initial stage of syphilis and typically appears within 3 weeks of exposure to the bacteria. Its distinctive appearance makes it a key diagnostic feature for healthcare professionals. It appears at the spot where the bacteria entered the body. This entry point is crucial in understanding the infection's progression. The bacteria, Treponema pallidum, penetrate the skin or mucous membranes, leading to the formation of the chancre at the site of entry. In later stages, ulcers may be more numerous and painful. As syphilis progresses, the initial chancre may heal, but the infection can spread throughout the body, leading to more severe and widespread symptoms. Secondary syphilis can cause a rash, mucous membrane lesions, and more extensive ulceration. Any genital ulcer should be a reason to see a doctor. Early consultation with a healthcare provider can lead to timely diagnosis and treatment, preventing complications and further transmission. It's important not to ignore these signs, even if they seem minor or painless. They can determine the cause and provide appropriate treatment. Treatment typically involves antibiotics, which are highly effective in eradicating the bacteria if administered early. Follow-up care is also crucial to ensure the infection is fully resolved and to prevent reinfection or transmission to others. Section 7. Early detection is key. Early detection is crucial in managing syphilis. If you suspect you may have been exposed, get tested immediately. Don't wait for symptoms to appear. Syphilis can be diagnosed with a simple blood test. Early treatment can prevent the disease's progression and the risk of complications. Remember, syphilis is treatable at any stage, but early intervention offers the best outcome. Section 8. Diagnosing syphilis. Diagnosing syphilis is usually straightforward. Your doctor will ask about your sexual history and any symptoms. They will then perform a physical exam. The most common test for syphilis is a blood test. This test detects antibodies that your body produces to fight the infection. In some cases, a fluid sample from a sore may be tested. This can confirm the presence of the bacteria. Section 9. Treatment, a course of antibiotics. Syphilis is curable with antibiotics. Penicillin is the most effective antibiotic for all stages of syphilis. Your doctor will determine the best dosage and duration of treatment. If you're allergic to penicillin, alternative antibiotics are available. It's important to complete the full course of antibiotics. Even if your symptoms disappear, stopping treatment early can lead to the infection returning. After treatment, your doctor will monitor your progress with follow-up blood tests. This ensures the infection is gone and prevents reinfection.